I will be doing my TED Talk on the Epstein-Barr virus. And before I continue on with this TED Talk, I do have a little story to tell. I remember when I was younger, my friend had gotten sick with this virus, and I ended up getting it. And I remember it was pretty scary at the time because I remember the doctor specifically telling me that I could not do any crazy physical activity because my spleen was swollen and it could rupture my spleen. And so I remember for months and months I wasn't allowed to do any physical activity. I couldn't jump on trampolines, I couldn't do any of that, and it was very sucky. And doing this TED Talk on this virus is interesting because I did not know that it was linked to causing other issues in health in the future. So, thank you. So, what is the Epstein-Barr virus? Well, it's one of the most common human viruses in the world. It's known as human herpes virus 4 and the kissing disease. It can cause infectious mononucleosis, also called mono, and other illnesses. Most people who get infected with Epstein-Barr virus in their lifetime don't know because oftentimes it causes no symptoms or they can slowly occur over time. And this is most common in teens and adults. How does it spread? Well, it spreads through bodily fluids, sharing drinks or food, kissing, using the same utensils, children's toys, etc. Some symptoms include fatigue, fever, inflamed throat, swollen lymph nodes in the neck, enlarged spleen, swollen liver, and rash. Some other symptoms that are in this little picture are soreness and reddening of the throat, chills, body aches, nausea, vomiting, reddening, swelling, and white patches of the tonsils, and headaches, fatigue, loss of appetite. So diagnosis. So there are some tests that you can use, which are also on the next slide, but typically these are not needed to diagnose infectious mono, but they can be used to identify the cause of illness in people who do not have a typical case of mono. So things to look out for are a higher white blood cell count than normal, unusual looking white blood cells, also known as atypical lymphocytes, and fewer than normal neutrophils or platelets, as well as abnormal liver function. Epstein-Barr virus eventually infects about 95% of adults, but does not always lead to multiple sclerosis. In addition to monospot tests, there are also blood tests that are specific, such as the viral caspid antigen, which is antibodies to VCA that appear in early infection. There's early antigen, which are antibodies to EA that appear during active infection, and they typically become undetectable after several months. And then there is EBV nuclear antigens, which are antibodies to EB and A that slowly appear in the months following infection and can be detected throughout a person's life. So, as stated by Mr. Cox's article in The Guardian, the presence of this virus in our body has also been associated with 200,000 cases of cancer worldwide every year, which develop years after infection. Associations have been made between Epstein-Barr virus and Hodgkin's lymphoma, as well as other cancers of the head, neck, and stomach. Furthermore, it has also been linked with a range of autoimmune disorders, from lupus to chronic fatigue syndrome. Epstein-Barr virus is associated with the 4 to 10-fold risk for developing multiple sclerosis, and while symptoms subside, Epstein-Barr virus remains in the body for life after infection. So finding out that diseases such as these are associated with the Epstein-Barr virus is pretty crazy, but continuing on. There are currently no licensed vaccines for Epstein-Barr virus, and EBV infections don't respond to antibodies. So I have found articles that state there has been trials to test for a vaccine for EBV, but there have not been any groundbreaking findings that has led to a vaccine being distributed around the world. In one article posted by the National Institute for Health in 2019, the author speaks about 2 vaccine candidates that are designed to elicit antibodies to epithelial cells, and if I'm not mistaken, they tested on rats. And it states that it has been performed on animals, and it has given hope that the team is planning to conduct human trials, but we have yet to see a vaccine in 2022, and that article was from 2019. So, as I stated, there are no vaccines to protect against EBV infection, but some steps you can take to relieve symptoms include drinking fluids to stay hydrated, getting plenty of rest, taking over-the-counter meds for fever and pain, avoid extreme physical activity due to swelling of the spleen, and avoid sharing food and drinks with others, and avoid sharing utensils with others. And yeah, that's all. Thank you.